Welcome back to the Arthroscopy Journal. This is Michael Rossi, one of the associate editors. I'd like to highlight the February issue, and concisely here is what we learned from a rather robust monthly issue. First, a meta-analysis shows no difference in the clinical outcome between single and versus double row rotator cuff tears. However, in a systematic review, biomechanically the importance of the transosseous repair is shown by the need for tying the medial row sutures. This is in terms of ultimate load, stiffness, gap formation, and contact area. Next, outcome of arthroscopic versus mini-open rotator cuff repairs is identical at 1 year, but not surprisingly, at 6 weeks the results are better in the arthroscopic group. Next, a systematic review shows that traumatic tears of the rotator cuff are more likely in younger and male patients. These tears are large tears, and nearly 80% involve the subscapularis. The timing of these repairs is not yet sorted out. Next, advanced age is a risk factor for stiffness after rotator cuff repair, no matter the timing of onset. First, early postoperative stiffness is related to preoperative stiffness, while delayed onset might be related to the re-tear of the rotator cuff. So don't hesitate to check for re-tears if they have postoperative stiffness in a late period. Next, a systematic review and current concepts review shows no definitive treatment algorithm for the treatment of AC separations. This is in terms of the timing of surgery and the technique, whether anatomic or non-anatomic. In terms of Bankart repair, we learned that horizontal suturing may restore the labrum to native height compared to simple suture repair. Next, a meta-analysis of single versus double bundle ACL reconstruction shows once again that the double bundle has better anterior and rotational stability, but there is no subjective outcome difference clinically. Next, an arthroscopic surgery for knee grade 3 and 4 chondromalacia has a generalized mean survivorship of nearly 7 years. This has a 40% delay of total knee arthroplasty in 10 years. Grade 4 chondromalacia, not surprisingly, however, has a 5 times more likely chance of failing. Next, mesenchymal cells or connective tissue progenitor cells can be harvested from a local site on the proximal humerus and distal femur. We look forward to outcome studies of this new technique and outcomes in rotator cuff surgery as well. Please take a look at this technique video. In terms of arthroscopy fluid, lactated ringer shows the least problematic to cartilage metabolism, while normal saline is the worst. Again, that's just a summary of this month's issue. We'd like to thank you for joining us, and if there is any controversy generated from any of these articles, please don't hesitate to write a letter to the editor. In addition, please take a look at the videos that are presented during this month's issue. And thanks for joining us again.